Hi, Eric, the acupuncturist here. I want to talk a little bit about the process of getting acupuncture. So I specialize in pain, so if you're coming to me, it's because you have some pain somewhere. We need to find the source of the pain. If you watch my previous videos, I talked about the source of the pain. The majority of pain comes from these knots in the muscles that Western medicine is termed trigger points. Chinese medicine termed them Osher points. But we're trying to find the knots in the muscles. The knot in the muscle, when I examine you and feel around, I feel where it's too tight. Where it's too tight, you feel it is sore because it's hypersensitive, like I covered in some of the other videos. So I feel these tight bands, you feel, oh, it's sore, that's where my pain, it's reminiscent of your pain. Sometimes when you find that spot and have pressure on it, that pain can radiate to along an area that might be familiar to you. So once I find the knots, I'll usually mark them with a little pen, and there'll usually be a series of them. Oftentimes we find the knots right where you feel the pain, but there can be other knots that are sending an ache in the area where you feel it. So I'm pretty familiar with all these patterns. They call that referred pain. I'm pretty familiar with all those common patterns of referred pain. So I'll not only check exactly where you feel the pain, but I'll check these other areas that in my experience can be playing a role. Once I get them marked out and get your skin swabbed off, that's when I'll do the acupuncture to hit that knot. And you definitely feel something when the knot is hit. It's not necessarily painful, and for the most part doesn't feel like a needle. It feels like that deep massage, like that achy pressure or that twitch. We're looking for that. If you don't feel something, we're not in the right area. As I explained in the other videos, some of the other videos, these areas that are tense, they're hypersensitive. So when I am needling healthy tissue, you don't feel anything. Basically, you don't feel anything. Then when we hit the spot, you go, oh, that's it. You can feel it, all right? We're looking for that feeling. So don't be afraid of feeling something. It's like if you went to get a massage and you got a massage and didn't feel anything. What kind of massage? What would you think of that massage? You didn't feel anything. Of course, you want them to find the knots. That's the whole point. That's the whole point, right? Once they're needled, I do, it's not very common in the United States, but it's a traditional way to do it in China, is to warm the needle. That warming helps speed up the healing. It helps relax that tissue. If a spot has been tight for a really long time, 6 months, a year, more than a year, that area can get fibrous and that tissue is really dense and thickened, and the warming can soften that dense, thick tissue. So I'm going to show you a little bit. If you can see here, this is moxa here. This little piece, it looks like a piece of cigarette, but it's not tobacco in there. It's Chinese mugwort. This goes on a little basket, a little metal basket that holds it. This makes it easy for me to take it off if I need to. And every needle, I'm going to adjust the camera a little bit, every needle is going to get one of these on it like that. Now, there's two types of heat here now. When this is lit, there's two types of heat. There's the heat conducting down the shaft of the needle. Now I'm going to start to light it. The heat, one type of heat conducts down the shaft of the needle. The other type of heat radiates onto the surface of your skin. The heat conducting down the needle is the important heat. That's the heat that's going to get into that target tissue and really help heal things. Now that heat conducting down the needle never feels too hot. It never gets too hot. But that radiating heat, if there's a few needles close together, that radiating heat sometimes builds up too much and gets too hot on your skin. If that happens, all I do, I just shield your skin with a little aluminum foil like that. So during the treatment, I always count on you to tell me, oh, is it getting too hot? If it's getting too hot, I'll shield your skin. This is every patient's favorite part because it really does. It feels fantastic. You just get a nice penetrating warmth right in that area where you've been experiencing that pain, and we're going to get right to the heart of it and then really soothe it with that really nice soothing heat. All right.